Hi, your name is Mark Black, is that right?
That's correct. Yes.
Hi Mark, my name's Sue. I'm one of the therapists here at Align Time Massage Therapies. And I noticed you've come in today with a sore neck. What's been happening? What's been happening with that?
I woke up 3 days ago and I've got a very stiff neck. I can only move it like that before it starts to hurt.
Oh, really? But you can move a little bit to each side?
Just enough to dry.
Okay. Oh, my goodness. Oh, that's a bit scary. Anyway, I just wanted to check through your client form because I just wanted to make sure that we have a sort of a comprehensive understanding of your health history before we begin. And I noticed that you've been a relatively well person. You work as a registered nurse, is that right? But you're painting, I presume you're painting your own home. Yeah. Oh, gosh. And you've got a little bit of hypertension on some medication for that, some restless leg syndrome. You're on some cholesterol medication, and you've got some borderline glucose intolerance. That's not too much. Okay, and no musculoskeletal problems in the past? No. None at all? That's great. And you're not using any painkillers at the moment for the neck?
No, I can't. I can't reach them.
You can't reach them. Oh my God. So no one at home can pop a tablet in your mouth. Oh my goodness, okay. So if you were going to give you a score out of 10, 10 out of 10 is the worst pain you could imagine, what would you give it? What sort of score?
About 4 or 5.
About a 4 or 5. Does heat or cold, PAX help or anything like that?
No, I dropped it and it broke.
Oh, you're in a bad way, buddy. In a bad way. So is it affecting your ability to sleep at the moment?
I'm a little restless.
You're a bit restless, yeah.
Because the turning. Yeah.
Sure. Okay. And no surgical history, nothing to speak of recently? You haven't had any other illnesses like gastro or any other, nothing like that? Okay. And I noticed that you've got a GP that's in the local area, Dr. Karen Wilson, is that right?
Right.
So tell me what you would like me to do for you today. You just want to free up the neck a little bit.
Exactly. Get some more movement back and see if we can settle this pain down.
Okay, all right, absolutely. What I think we need to do now is we need to get you onto the table. We are going to be, you probably know from remedial massage therapy. Have you had a remedial massage therapy before? Just standard massage. So the difference between a normal, like a spa-related massage and obviously what I do is I'm a targeted therapist. I work around issues that problems usually, like people coming with sore necks and sore knees and that type of thing. So today we're not going to be doing like a whole body massage. We're going to be working on the muscles that affect the neck and the upper torso that I think might be contributing to your problem. What will happen today is we'll get you to take off your shirt, but you can leave your pants on, and we'll pop it onto the table. We'll do your assessment, full assessment of your musculoskeletal functioning, and then we'll come up with a treatment plan for you. I'll explain everything as we go through. And what I think is going to happen is we'll need to probably repeat the treatment in 7 to 10 days. And then also combining with some other types of take-home treatments for yourself, like some hot packs and things like that. Do you think that's something you could go with? Absolutely. Okay. Absolutely. Absolutely. So what I'll do, the toilet is just adjacent to the treatment room. If you need to go to the loo or anything before we get started, it will take about an hour to do this treatment today. You haven't got anywhere to be or what have you? Okay. And then repeating the treatment in about 10 days, I think we'll see how we go. Even if you're better, I'd like to see you again to make sure that we've got to the point where we can let you go and get back to your painting. All right. Talk through there. I'm just going to step out and do some administrative work on your history. Only be gone for about 3 minutes. When I come back in, I'll find you on the table and we'll get going with the treatment. Just finally, though, I noticed that you've signed the consent form. And you've initialed each of the points that I've made there. Is there anything that you wanted to clarify with me before we get going? Okay, no worries at all. And please, at any time, feel free to ask me any questions about what we're doing, how we're going about it. If you feel I'm too firm or too soft or whatever, let me know, because it's very important that you're comfortable throughout the entire, throughout the entire journey of this treatment, but keeping in mind that you may feel some level of discomfort as we go. All right. Okay, I'll be back in just a minute. Thank you.